The small change that I implemented as a third-year student was to undertake disposable tourniquets into a community setting. I decided to select 4 district nurses to use a variety of disposable tourniquets, which you can see displayed here, for a 2-week trial. The tourniquets which were used were the Veniquet, the BD Stretch, the Intervene, the Lesmar, Tournistrip and Medisaver. The reason I selected 6 different types of tourniquet was to try and find out which one they would adapt in future practice. I also selected 20 patients to be involved in the study, and when the district nurses was use these tourniquets to perform the venipuncture procedure. So after observing the district nurses in practice and travelling along with them to community settings to visit patients, I noticed how they were stored. I noticed that the tourniquets were often put into the pocket along with tissues, pens, car keys, or maybe in the boots along with the dog basket or the running shoes, you name it, it was in the back of that car. I also noticed how they were used. A lot of district nurses had the lucky tourniquet. They used it on one patient, another patient, and it was hard to know how do you decontaminate these reusable tourniquets. Some of them look really old-fashioned as well. Also, attitude towards the tourniquet. Sometimes it's kind of disregarded, like a pen, you throw it on the desk, you come in, throw on the desk, get a cup of coffee, talk about your day. There was no clinical significance or respect given to these tourniquets. But also, as well, when I was going into the community setting, the district nurses were using alcohol gel to decontaminate their hands, and obviously with their hands they're using the tourniquets. And I noticed this could be a problem because the alcohol gel can only be used up to 8 times consecutively before it becomes ineffective. So with this, I started thinking about healthcare associated infections. So the improvement tool that I used was the PDSA cycle. To aid the pilot study, I implemented this cycle, which incorporates 4 stages: the plan, do, study and act. I use this tool because it allows safe and effective testing of new change on a small scale change. It allows me to identify what phase any problems occur so I could easily go back and address them. Also, this cycle brings immediate change which stimulates enthusiasm for all individuals involved, thus promoting ownership of the project. The results from my study showed that Intervene, as you can see displayed on the screen, was the most preferred tourniquet among the patients, as they stated it provided the most comfort and appeared the most professional. All 4 nurses said that Intervene was the easiest to use within the trial. They also preferred it to their reusable tourniquet and would be happy to use this within the future. Staff also said that they liked this because it was similar to reusable tourniquet and worked along similar ways. The Intervene sample also received favourable comments from staff on the individual wrapping, as you can see displayed here. This was the only tourniquet to come in its own individual wrapping, encouraging that it was hygienic before use. They also believed that this was the true disposable tourniquet, as this tourniquet has a locking clasp and you have to rip the actual band that goes around and it can't be reused again. The Veniquet and the Tournistrip samples were also a popular choice among the 4 nurses. However, some service users commented negatively on their appearance and comfort, stating that it was pinching the skin, but I'm not too sure if this was down to how the district nurses used them. The majority of staff found that the BD and Medisaver and also the Lesmar pharmaceutical samples difficult to fasten, thus not providing adequate circulatory restriction. After the pilot study, the disposable tourniquet wasn't implemented by the district nursing staff, even though it received favourable comments about how it was used within practice. During the trial, I felt like there was some clinical barriers. A lot of them had the attitude, if it's not broken, why fix it? It works for us. And others just didn't want to part with their lucky tourniquet. It was quite a challenge to prize it away from them. So with this in mind, if one small change can't be brought about, how can we bring forth big change?